Welcome friends. As you all know, it's World Hypertension Day on 17th May. Life is very important and longevity and quality of life, though, is a gift of God. We need to maintain this by all possible means. Hypertension or high blood pressure is a major disease which can affect the health. Let's talk to prominent personalities along with Dr. Vidyut Jain, cardiologist from Indore, national convener of Hypertension Sub-Council of Cardiological Society of India on the occasion of World Hypertension Day.
It's my proud privilege to be with you on the occasion of the World Hypertension Day as the national convener of the Hypertension Sub-Council of Cardiological Society of India. Cardiological Society of India is committed to increase the awareness about the hypertension and prevention of its complications through this media. Hypertension is common in rural and urban population equal nowadays. But the incidence of blood pressure is day by day increasing, and there are many factors like overweight and obesity, increased consumption of tobacco, increased consumption of the salt, and then the mental stress, and sometimes it is a familial inheritance, and other diseases like diabetes and high cholesterol can also increase the blood pressure problem. Our attempt should be to prevent it as early as possible. Whenever this complication of the blood pressure occurs, they occur due to stiffening of the arteries and the less elasticity of the arteries, thereby the arteries get narrow in the hypertension and the blood supply to the various parts of the body gets affected. Occasionally these arteries may get ruptured and can lead to the hemorrhage. Now, increased incidence of hypertension leads to increased probability of getting heart attack in future, heart failure in the future, kidney diseases, strokes like paralysis, hemorrhage in the brain, and sometimes hemorrhage in the retina. So all our attempts should be to take care of this. Now our expert will be talking to you for the other aspect of the hypertension.
Hypertension is one of the most important causes of cardiovascular morbidity and mortality. About 4 out of 10 adults have hypertension, but unfortunately, most of these patients remain undiagnosed. Prevalence of hypertension is increasing in India, especially amongst younger individuals. Timely diagnosis and effective treatment will help avoid complications of hypertension. Optimum salt intake, consumption of abundant fruits and vegetables, avoidance of smoking, alcohol and weight gain, and regular exercise will go a long way in its prevention and management.
Dear friends, I bring you the greetings from CSI headquarters on the occasion of World Hypertension Day on 17th of May. I must tell you with a great deal of confidence that all of us should know what is the theme of World Heart Day this year. The theme is know the number of your blood pressure. If you see the prevalence rate of hypertension, the prevalence rate of hypertension in India ranges from 20 to 40% in the adult population in urban area, while in the rural population it is 15 to 20%. As the age increases, the blood pressure also increases. A very powerful data which was collected last year on 21st of September by CSI on the occasion of Cardiac Prevent in 1.8 lakh patient have shown very clearly that in India the prevalence rate is up to a tune of 35% in the adult population. And the surprising thing was 42% of the patients were uncontrolled. That means the medication is given is not adequate. The patient are not explained properly. They are not followed properly. So what's my message? The message is early detection, early evaluation, and optimization of the treatment is the need of the hour. Thank you very much.
The intervention cardiologist and the director of Cath Lab at the Ruby All Clinic, Pune. On the World Hypertension Day, that's the 17th May, it's my important responsibility as the president for CSI 2017 to highlight the importance of hypertension as a cause of many complications. As one knows that when we say blood pressure has to be controlled, it is going to avoid a lot of complications, which in turn affect heart, brain, kidney. Heart per se gets dilated, gets weak because of long-standing hypertension, and can ultimately lead to heart failure, which again has its own consequences. Hypertension can also contribute to development of atherosclerosis, that is the cholesterol deposition, which ultimately can predispose you to myocardial infarction. Hypertension uncontrolled can certainly harm the kidney on a regular chronic basis, and one can see untreated hypertension running into kidney issues where slowly kidney function goes down, both kidneys shrink in size, and ultimately these people need dialysis on a regular basis. Brain is a very vulnerable organ, responds to high blood pressure. So many times people understand an intracranial bleed where a patient presents with a stroke. Patient could be suddenly unconscious and even die out of this complication. So all these are very crucial. On the whole, hypertension remains a very key issue to the most important organ, the kidney, the brain, the heart. The good thing is if we are able to control blood pressure effectively, we can control all these complications too.
Hypertension in young is a major problem nowadays because of the fact that stress and strain, lack of physical work, increased intake of various kind of junk foods, and the lifestyle, that is lack of physical activity, and also increase in the intake of salt. All these factors have actually contributed to the formation of or the new development of hypertension in young. Now, if we cannot detect the hypertension in young people, then these are the people who are going to have all the target organ damage in the form of left ventricular hypertrophy and failure, myocardial infarction, stroke, then kidney disease, eye problem, and last but not the least, the peripheral vascular disease. So we must have the modalities to take care of these young patients of hypertension.
Dear friends, after listening to the expert on hypertension from different parts of the country, now we should think over how to detect patient with hypertension at early stage. Number 2, reduce the incidence and prevent the hypertension. And number 3, how to manage them. Number 1, we should increase the motivation for periodic blood pressure checkup after the age of 40. All those persons who have a high susceptibility of hypertension, like other family member if they are having hypertension, the rest of the adult family members should also go for blood pressure checkup. And we should always try to follow the instruction given by the doctors for the blood pressure management. Always ask your doctor what is safe limit of my blood pressure. Number 2, you should also ask if I can manage my blood pressure with usual lifestyle modification, that will be the best to reduce the pill burden. Nowadays, once you are decided that now you need a blood pressure treatment by the medication, get ambulatory BP monitoring, so you know when your BP is going up and high. So the dose of the drug can be decided properly. However, once they decided you require drugs, then you should take drugs regularly, but definitely under medical supervision. So we all should come together and join the band how to prevent blood pressure and how to prevent the complication of blood pressure. Thank you.